it's Mike's from Diabetes World. It's been a while since the last time I checked in with you, but we finally decided to get back into this, and it's always been something in the back of my mind. So I did it, and we're ready to get going. Now, I thought probably the best way to do this is to do what I used to call a checkup. And that's me telling you how I'm doing. Well, it's been a difficult road. I was taking care of my mom 2019, the beginning of 2020. August of 2020, my mother passed away. It was a long battle with not depression, sorry. Oh, I can't do dementia. Dementia. I don't know why I get those two mixed up. And so she passed on. December of that year, actually November 28th, I guess I had called a friend and wasn't really making too much sense. And he came over, and I see to walk back and forth all over the apartment. And he finally called an ambulance. And the ambulance came, and to me, I was feeling fine. And I know that now you really have to take a look at that and say, are you really feeling fine? But most diabetics will, somebody comes and asks, are you low? No, I'm fine. And you could be totally out of it. But I wasn't. They came and they did a blood test, and they found that my blood sugar was quite high. I don't know exactly what it was at, but it was high. And I can remember being moved onto a stretcher. They didn't want me actually standing. I remember being moved onto a stretcher, being taken downstairs, and loaded up. No, they actually did treatment on me down in the hall, in the main hall of our building. So that's kind of sort of thinking back on it, I thought, well, they must really have thought that things were bad enough. Well, we finally got into an ambulance, and I can remember I just couldn't get comfortable. My arm was always in, kind of, seemed like I was laying on my arm. I wasn't, but it just seemed like that. They got to the hospital, and I don't really remember checking in, because I know when I go to the hospital when I'm low, I can remember being checked. I don't even remember that. I was put into a isolation treatment room. And I can remember them starting IVs in there. And I was told I was in DKA. And I kind of went out of that for a while. And the next thing I can remember is being up on what they call a high acuity unit of the Royal Columbian Hospital. And it's kind of one step down from ICU. And I went in there. I don't remember going there. I can remember all of a sudden getting there, and I can remember I had chicken drumstick dinner. And then I don't know if it went to the next day or not, because I wasn't with it, guys. I was totally out of it. And I was moved to a ward. And I went up to the ward, and I thought things were going okay. But I guess I was sort of delirious. And to me, thinking back to it, I can still remember thinking, oh, let me see, that the hospital itself was part of a new and a part of a really old hospital. And the best way I could say it was there was this old television program called Doctor in the House, where it was comedy and people took care of people as they were learning to be doctors. And it was St. Swithin's Hospital, and it was really in kind of a Gothic type building. And that's kind of what I had pictured in my mind. Outside of my room, there was the nurse's desk or nurse's center or whatever you want to call it. And there was a table and chairs where nurses could sit down and do their charting or whatever. And I can remember thinking that was like a French cafe. I don't know. Oh, sorry, itchy eye. I went to, in my mind, this is all going on. I went and was put into, it seemed like I was put into the parking lot. I don't know why they would be putting patients in the parking lot, but that's where I went. And a friend came and visited me, and he came and said hi, and I guess he left. And I had to go, I guess I was getting ready for a colonoscopy. And because I had intestinal problems, they wanted to do a colonoscopy on me. I had to drink this stuff. And I thought I don't know why I was thinking this, and I spoke this over with the nurse who it was. I thought I was at her place in the back of a pickup truck, and they were watching TV on a huge TV. Like, this TV was the size of a wall. And I couldn't, like, in my mind now, I'm going, oh my God. And that was fine. Next day, they came and got the colonoscopy. And again, I went to a nurse's home for it. And in her basement, I was given the colonoscopy. Now, I don't know why, but I guess it was the nurse I had all day, so I, in my mind, was playing tricks on me. I can remember kind of waking up I really wasn't out of it, but I guess I had slept, and I kind of woke up thinking it was the next day, and the nurses had taken over the hospital. Oh my God. They weren't listening to any doctors. They had just taken over the hospital. And I remember sitting up. Now, I probably was just sitting up in bed, but it seemed like I was sitting on kind of a circular couch type deal. And she gave me some sort of pudding to eat. And then I sort of was out of it for the next couple of days. And I finally, I guess my body, they got my blood sugars back down. They got the ketones out of my system. And I started coming around and starting to be okay. And to this day, I don't know what goes on in my mind those days. But I got over that. I was in there in the hospital till March 15th, I think. And I came home, and I've been at home. I haven't really got the walking down yet. Like I have to use a walker or my chair. Now, I was using my chair before, but my legs just haven't really seemed to get the movement back. Okay, so what's gone on? Well, I still have stomach issues. They attribute it to a lazy, I think they call it lazy intestine, but where things aren't pushed along at the rate it should be. So that helped not. I had cataracts. I can remember lying in the hospital bed, looking up at the wall, and on the wall there was a chart where they would write who your nurse was, what you're in for, how, when you were going to be discharged type thing. And that I couldn't see that. And it was probably 10 feet away. I'm trying to think. Yeah, about 10 feet. I'm 6 feet and 4. And I really couldn't read it. Now, I thought here, I just needed a change in my eyeglass prescription. Well, if any of you have taken a look at my prior videos, you notice something's missing here. Gee, I don't have to wear glasses anymore. I had cataract surgery. And this eye was done first. And it took a while to come back. The surgery was longer than we expected. It was quite overgrown. And, when I went like this, it was kind of very cloudy, and it almost looked like a shower glass door, that's frosted. That's kind of what it looked like. And so I got that removed. And like I said, it took a while for it to come around. And I can remember coming home. I could see better. Like I could actually see. It wasn't clear, but I could see. And I waited, I think, roughly about a month. And this eye was doing great. It was outperforming this eye. And in fact, I would watch TV like this. I'd be doing like this for most things. I got this eye done, came back, closed this eye to see how much blurry this was. This eye was crystal clear. It was almost like it had healed in just the day. I didn't feel any pain. Yay! Pause. But I got the cataracts done, and it's weird still to me that I don't have to wear glasses. I think you can still see here I've had imprints of where I used to wear glasses. Now, to be perfectly honest, I do wear glasses for reading. I am at that age anyway, so getting along in ages. I'm starting to see what I call a fat doctor. I guess it is internist dealing with obesity. I was always a big kid. But later in high school, I kind of shot up and I was a beanpole. But as the years moved on, I kind of gained weight. And I'm sorry, that was just my chair shutting off. I have a lot of swelling too, like holding on to water. But I do have fat too. I'm not going to tell you what my weight is because it's embarrassing. But I'm taking action, and right now I'm on protein shakes in the morning, and that kind of helps fill me up. I take type 2 diabetic medication, Ozempic, which will help. Sorry, I'm just... and that kind of curves my appetite. I've had a few lows. I've gone in a couple of times. Sometimes I just sign the form and saying, I don't want to go to the hospital. Because you go to the hospital, they don't really do anything for you. You know, we can monitor here, so why not go? The big thing is, we thought I could get into some sort of assisted living. Because I've had problems with my diabetes, and it's been ongoing for years. This isn't sort of a thing, well, last 6 months it went crazy. And I signed up for assisted living. I had my worker come out, and I was told I couldn't go into assisted living because it was too complex. I needed to choose rest homes. Well, they used to call them rest homes. I think they call them long-term care now. And while I had to choose 3 places. I chose 3 places, and then they came back saying, well, you don't qualify because of your size and your equipment. These places can't handle you. So I had to be put on a wait list again. And then they kind of thought of a hospital for me. They called it George Pearson Hospital. And I wouldn't have really mind. But I think George Pearson is deals with more spinal cord injury cases than that. I think I would be out of their specialty. And that's why it was sort of said that I didn't qualify there for. So now they're looking for an intermittent place because this condo is being sold or will be sold. And you know what? I'm fine with going to home as long as I can keep doing this. And like I said, I'm going to try to get back into this. A lot of times, things just get away from you. And it'll be good to just keep things going and develop what you really need to develop. I've got a lot of the equipment, so it's not going to be a cash outlay, which is positive. So I'm still on the heart medication test, and that kind of brings you up to where I am today. Still have home care, and I think my body's been through quite a bit over the years. And now it's time for me to move on, get rid of some of this weight, hopefully. Get rid of all this double chin. But it's nice to be back and talking with you. And I'll be back shortly, or hopefully tomorrow I'll come up with something to discuss with you. Anyway, have a great day. Talk to you later. Bye now.